The double dividend of safety is the idea that if we reduce people's exposure to risks that are beyond their personal control, that not only makes them safer, but it actually also could encourage them to take better care of their health. And the reason for this is that when people face uncontrollable risks to their health and safety, it reduces their chances of living to an older age. And some of those benefits of a healthy lifestyle aren't felt until later in life. Often the way that we explain this is with a thought experiment. So we ask you to imagine that if you were to believe that you are highly likely to die due to something beyond your control, let's say a natural disaster risk in the next decade, would you be motivated to quit smoking, to take up running, or to cut down the amount that you drink? For most people, the answer would be no. And that gives you an extreme example, but one that helps you to understand how uncontrollable risks might affect health behaviour. And it doesn't need to be a dramatic risk, like necessarily the risk of dying in an earthquake or in a war, but it could be a series of more subtle risks which we face day to day, which accumulate to affect people's sense of control over their health and their long-term risk. We call this the double dividend of safety. First, we get the direct benefits of the safety improvements themselves, such as reduced transport accidents or lower rates of violent crime. But then secondly, we would see benefits in terms of improvement in health behaviour. So for example, healthier eating, more exercise, or potentially reduced smoking. If a range of organisations work together to reduce people's exposure to risks, people won't just be safer, they'll also live healthier lives.
The Double Dividend of Safety project is funded by Lloyd's Register Foundation and led by researchers here at Northumbria University. So the main goal of the project is to raise awareness of the double dividend of safety concept itself and hopefully to help organisations to incorporate it into their work. The project has two key areas of focus. The first area is delivering a series of tailored workshops to organisations whose work has an impact on experiences of risk, conditions of safety, or who are working to improve public health behaviours. And the idea is that these workshops can help organisations to understand some of the key concepts from our work, but also to support them to identify, measure, and hopefully articulate some of the health behaviour benefits of their work to improve safety. The second key area of this work is we are aiming to use data from the Lloyd's Register Foundation World Risk Poll, which is a global survey of perceptions and concerns about risk. And this is delivered to over 140 different countries. So we aim to use these data to create a data dashboard which organisations can use to estimate the expected health behaviour benefits of tackling key hazards in their regions of interest. I really think that the project will be relevant to a whole range of different organisations, whether they're working in industry, working in the charitable sector, or working with governments. And this is because different types of organisations can all have an impact on people's conditions of safety and ultimately impact their health behaviours. And I feel that people can benefit from the tools and resources that we develop through the project by allowing them to demonstrate the impact that their work to improve safety may be having on people's health behaviours. And this may be useful for organisations to help strengthen safety policy campaigns, possibly to make stronger cases for funding, and also to help them to direct their activities so that they can maximise their impact. To find out more, please visit our website at doubledividendofsafety.org or reach out to a member of our team.